Hi, now let's learn about the premises of the theory. Narrative therapy is based on postmodern and social constructionist perspective that rejects the classification systems based on empiricism and promotes empowering persons and families by emphasizing their stories. It distinguishes between logical scientific reasoning and narrative reasoning and seeks to empower clients to find novel options and strategies for living by reauthoring their life. The primary focus is encouraging the clients to become the active author of their life by giving or sharing their experiences and disclose about how those experiences affect their perceptions. In narrative therapy, problems are seen as external to person and families. The underlying perspective is that people and their problems are separate and that each person has his or her interpretation of events or what is commonly referred to in narrative therapy as their story. According to narrative therapy, problems should be attacked in a cooperative manner by families who work as teams and utilize their resources. Individuals, couples, and families can definitely benefit from this narrative therapy. Those who define themselves by their problems, whose life are dominated by such feelings as I am a depressed person or I am an anxious person, can learn to see their problem as something they have, but not something that identifies who they are. In narrative therapy, the events that occur over time in a person's life are viewed as stories, some of which stand out as more significant or more faithful than others. These significant stories that usually stemming from negative events can ultimately shape one's identity. Beyond this identity, the narrative therapist views a client's life as multi-tiered and full of possibilities that are just waiting to be discovered. The therapist does not act as the expert but rather helps client see how they are the experts regarding their own life and as such can uncover the dreams, values, goals and skills that define who they really are that separate from their problems. These are the buried stories that can be rewrite into the ongoing and future story of their life. It might seem too simple, even foolish, to think of solving problems like an eating disorder, depression, or domestic violence by writing a new story of your own life. But therapists who work with narrative therapy often combine the rewriting of a story with other strategies to help a person get on a positive track. Narrative therapy is not making up a completely fictional life story. It's more like revising the negative stories that people keep on repeating to themselves. Changing negative thinking patterns, which is part of many types of therapy, might start with writing your way to new patterns in your life. It focuses on looking at your own life from a bit of a different and perhaps a more positive perspective. Now, let's have a look at the process and the outcome of the therapy. The first stage of the process is deconstructing the dominant culture narrative. After that, externalizing the problem and finally reauthoring the story. The art of narrative therapy is not just telling stories, externalizing problems, and approaching the client with cultural competency. If this were the case, the theory itself would not effectively help a client resolve presenting issues. There is a human aspect in the method that requires the therapist to view the clients as a unique individual lacking in deficiency and defectiveness. The client should never feel that he or she is the blame of the presenting problems, nor should they blame anyone else. but the client should view him or herself as the ultimate expert of his or her life in the therapeutic relationship. Narrative therapy is relatively new in comparison to traditional therapeutic methods. There is a shortage of scientific research supporting the overall effectiveness of this approach. Additionally, certain types of clients would not qualify as good candidates for narrative approaches. In particular, clients with psychotic issues or who have limited intellectual, language, or cognitive skills probably not really suitable to this approach.